I knew very early on that I wanted to be an orthopedic surgeon, having met some very interesting and colorful orthopedic surgeons while I was in medical school. And I'm very sporty and outgoing, and I love to keep fit and healthy, and it just was a natural fit. I also love working with my hands, fixing things, and it just goes really well with that kind of stuff. My patients know I'm a straight talker. Sometimes I just don't beat around the bush, and I tell them, look, you've got a couple of choices, but you really need to have surgery. Most often that isn't the case, but often I will be very direct and just forthcoming, and that's kind of my nature. It often takes years before somebody gets to surgery, frequently. So we will exhaust all conservative measures. Often that's not indicated, and somebody's personality is just like, no doc, listen, we can't do that. We got to just go. I got things to do. I got races to run. I got cities to visit. I got mountains to climb. I got ski slopes to fall down on, and all that kind of stuff. And I understand that. Everybody's different. My philosophy is move as quickly as possible. And so I encourage patients to go home, not to skilled nursing facilities. And I encourage patients to do overnight stays, get out of the hospitals as quickly as possible, surgery centers as quickly as possible. And so if there's no contraindication to immediate weight-bearing activities as tolerated, it's just go very rapidly. I really believe that it's very important psychologically and physically. I think that listening to patients is an art, and it's kind of a lost art in a way, and it's it's probably the most important thing. And as I get more experience as a doctor and I learn more and more, you've got to really listen. What is it that's going on? What exactly do they want? What I see on an x-ray or an MRI and what I know can be fixed is got often nothing to do with what the patient wants. And in terms of ultimate goal might not to be get back range of motion, being able to jump and run. Let's just give me a little bit of pain relief. That's all I want to know. Or tell me what the best physical therapy is. That is their goal. And so listening is really, really, really important. Everybody has different goals and different thresholds for safety and how they want to live their life, and that's okay. You realize that you can't just tell everybody, hey, you got to be careful with this, you can't do that. And I've learned that, and it's interesting seeing. I like to listen to what folks really want to do with their life, what drives them, what's important. Is it walking your dog? No. Is it surfing? Big time here in San Diego, surfing. Whatever it is, and we can figure out a plan. We go through a lot together. I mean, it's an incredible journey that patients and doctors take in getting them healed and taking them through the difficulties of surgery or even no surgery. But I try to find the best in people, and it often comes out. And I think that's probably the reason why. That is probably the biggest compliment that my patients want to be my friends.